To prep the animal, have the restrainer put the animal in a sitting position, making sure they have a firm grip on the animal. To give the medication, the individual administering the pill will place one hand around the muzzle and gently pull the head back. Best way, the animal's nose is pointing towards the ceiling. In the other hand, hold the pill between your thumb and index finger, and using your middle finger, pull the mandible down by applying a gentle pressure to the incisor teeth. Depending on the animal, this may take a couple tries. Once you have a wide enough opening, quickly place the pill towards the back of the throat. If possible, push the pill further down the throat with your index finger. Quickly close the animal's mouth and lower the head to its normal position. Be sure not to release the muzzle and keep the mouth closed until the animal swallows. Finally, record the procedure in the animal's file.
Begin by putting the correct amount of medication in the syringe. The restrainer will now put the animal in a sitting position while holding it appropriately. The individual administering the liquid medication will now place a hand around the muzzle and elevate the animal's nose slightly. Be sure to not squeeze the mouth completely closed. Now put the syringe at the corner of the lips with the tip of it placed between the molars. Slowly start to inject the medication while allowing the animal to lick and swallow. If the animal is struggling or coughing, stop administering the medication and allow the animal a short break before continuing. Do not go so fast that the medication comes out of the mouth or they don't have enough time to swallow. Now write in the animal's file what medications were given, the reason for giving the medication, the date, and your initials. Have the restrainer put the animal in a sitting position. The individual administering the paste places the prescribed amount of paste onto the index finger of their dominant hand. The free hand should wrap the lips of the top jaw around the teeth and slightly elevate the nose. This should open the mouth enough so the paste can be quickly scraped off the index finger by sliding it along the hard palate and upper incisors before the animal has had time to close its mouth. Observe the animal to make sure all medication is ingested and write in the file what medication was given, reason for giving the medication, the date, and your initials.
Have restrainer put animal in appropriate hold. Loosen needle cap so it is ready when giving the injection. For sub-Q injections, find any loose skin on the lateral side of the animal, staying off the midline. Pick up fold of skin, making a tent shape. Insert your needle at a shallow angle going into the fold of skin. Once the needle is inserted, let go of the fold of skin and feel for the needle. Aspirate, making sure you have not entered a blood vessel. If not, inject substance. If blood appears, take out the needle and try a different site. Remove syringe and properly cap your needle. Write in animal's file what substance was given, area of injection, and reason for injection.
Injections deliver fluids directly into the vein using a needle. Typically in dogs, the cephalic or lateral saphenous vein is utilized. First, you must locate the cephalic vein, which is on the dorsal surface of the dog's front legs between the carpal joint and the elbow. Use clippers to remove the fur above the vein, exposing the skin and shaving away the least amount of hair necessary. Sterilize the area with a piece of gauze covered in surgical disinfectant from top to bottom. Position the needle over the center of the vessel at a very shallow angle. The needle should be almost parallel to the vessel. Aspirate the needle, making sure that the blood appears in the hub of the needle before injecting the substance. Afterwards, properly cap the needle and write in the animal's chart the amount of substance given, the location of the injection, and the reason for the injection.
Spray the site with 70% alcohol and rub with a cotton ball. Rub until the area is clean. You're now ready to insert the needle. Making sure the bevel is up, insert the needle at a 45-degree angle from frontal muscle toward the vertebrae or tail head. Aspirate to see if you've accidentally inserted the needle into a blood vessel. If not, it's okay to inject substance. If blood appears, remove the needle and try a different location. When complete, be sure to write an animal's file. Make sure to include what was given, amount of substance, area injection was given, and reason for the injection.
Start off with your syringe and your needle. So you're just gonna twist that on tight so it's on. Then you're gonna lay it down and slowly just twist the top part off like that, and then you're gonna partially leave it off. You want to make sure that your beveled edge is lined up with these lines so you can read it properly. Then you're gonna have the right hand technique. Pop off the lid. You're gonna pull down to aspirate, make sure that it's all good. Push back in. When it's time to go back in, set it up, and cap your lid up.